I have Dr. Daveluy with me. He is a fantastic dermatologist, and I've had a question for a long time on the Hurley staging system and my confusion around it, because I was a stage 1, I progressed to a stage 2, and then a pretty advanced stage 3. I met up with a dermatologist, I got a de-roofing surgery, and for me, in my experience, it was very beneficial. But now I don't know. Am I a stage 2? Am I a stage 1? Am I remission? Where am I now so that I can properly communicate to all my HS friends where I am on the staging system now?
That is a big point of confusion that comes up a lot. Here's how I look at it. I would consider you a stage 3.
Okay.
And my reasoning is because some people don't go from stage 1 to stage 2. Some don't go from stage 2 to stage 3. Your disease went to stage 3, so I know what it's capable of. And so we need to keep it under control, because if we don't, it could go to stage 3 again. Versus someone who's stage 1 and stays stage 1, their disease isn't progressing through the stages.
Also find how you allow us to stay in the stage we progress to. So you're saying because I progressed to a stage 3 that I'm going to stay in a stage 3 because that is where my body has progressed to. I find that your take on that is very beneficial, I believe personally, because it doesn't take away what I went through. So if somebody's to look at me now and go, well, now you're a stage 1, I don't feel that I'm a stage 1 because I have the scarring now from surgeries of a stage 3. I don't look like I did when I was a stage 1.
Yes.
And also when I go to talk to people, I find that it doesn't tell my story. If I'm like, hi, I have stage 1 HS. But that takes away from what I went through. And also, my other thing that I find is important that we've talked about is the wording around that, because I am a stage 3, but I'm not flaring. So I find it's beneficial when I say I'm a stage 3 that's well managed, which is something that you talked about, because it allows people to know that I have stage 3 HS, and it's well managed. And it's well managed thanks to dermatologists like you that are providing us treatments. So thank you for doing all that you've done, all of the schooling, all of the learning, coming here to help us go from an advanced stage 3 to a managed stage 3. So I have my answer. I am a managed stage 3.
It's also the same reason if someone is stage 3 in one area,
Okay.
but stage 2 or stage 1 in others, I consider them a stage 3 because I know that their disease is capable of going to stage 3. It's done it in your left armpit, it could do it in your right. And my management strategy is then adjusted to consider it, all right, this is disease that could progress to stage 3. We need to make sure it doesn't.
Thank you so much.
My pleasure, thank you.